So next is gallbladder cancer, v10. A 46-year-old woman is referred to you for intermittent right hypochondrial pain of several months duration. An ultrasound scan of the gallbladder shows gallstones and also a thick-walled gallbladder of varying thickness between 0.5 to 1 centimeter at parts. The biliary tree is not dilated. How would you manage this situation? The common causes of right hypochondrial pain is this age group would be gallstone disease, which is demonstrated in ultrasound scan. However, the presence of thick-walled gallbladder, varying thickness of wall, could lead me to suspect other chronic cholecystitis or gallbladder cancer. A further investigation with cross-sectional imaging, either a CT or MRI, will be useful in looking for additional features that may help in the diagnosis. A CT was done, and apart from showing a thick-walled gallbladder of varying thickness, that also enhances in part, did not show any other lesions. How would you proceed? So sometimes CT and MRI also can't differentiate between chronic cholecystitis and the carcinoma of the gallbladder if it's not metastasizing or involving the adjacent structures. The appropriate next step is to counsel the patient for the surgery, as both chronic cholecystitis and the gallbladder cancer would require surgical intervention, although the external surgery is different. I would advise the patient for an open as opposed to a laparoscopic cholecystectomy in the external resection, as to whether it involves the resection of the gallbladder bed, as well as also need advised and consented. In addition, there may be a need for lymphadenectomy, portahepatitis, lymph nodes, and the extrahepatic bile duct. In some situations, patient should also be suitably advised and consented for such. Can you describe surgical approach of this patient? So I would do supine, right Coker's subcortical incision, perform laparotomy for evaluation. If diagnosed with gallbladder cancer, the obvious gross inspection, I would proceed with the radical cholecystectomy with en-bloc gallbladder bed with the liver section of the gallbladder bed, which is segment 4B and 5. The cystic duct margin and the lymph node of Lund will be sent for frozen section to determine if these are clear of the tissue. In the event that lymph node is positive, a radical lymphadenectomy needs to be performed of the aorta of the porta hepatis and lymph node. This is often performed with the resection of the extrahepatic bile duct, especially if the cystic duct margin is positive with the hepatic duodenostomy reconstruction. Thank you.